Well, good afternoon, everyone, and welcome back to our 2:30 update. Before I get into today's conversation, I want to address the ruling that came out of the Clay County Circuit Court yesterday. First, the stay-at-home order, designed in close consultation with scientists and public health experts, remains in place. As it stands, the judge's ruling is limited, applying only to one person, the state representative from the 109th District. For those unfamiliar, the 109th District happens to have among the lowest hospital bed availability and ventilators in the state, making it uniquely ill-equipped to respond to a surge in cases. The district is also home to the county experiencing Illinois' highest death rate per capita from COVID-19. This ruling only applies to one person because it was only ever about one person. This was a cheap political stunt designed so that the representative can see his name in headlines, and unfortunately he has briefly been successful in that most callous of feats. As absurd as this charade is we are taking this matter very seriously. While the court's order is limited, the risk it poses is significant. By agreeing with the plaintiff in this initial ruling, the court set a dangerous precedent. Slowing the spread of this virus is critical to saving lives by ensuring our healthcare system has the resources to treat patients who get sick. And we will not stop this virus if, because of this ruling, any resident can petition to be exempted from aspects of the orders that rely on collective action to keep us all safe. Because of the threat to public health from this court order, and the fact that the state has acted well within its legal authority to protect the health of the public, the state is appealing immediately. I know misinformation tends to spread quickly in situations like this, so I assure you that I will continue to provide you with updates on any new developments. But on this topic, I leave you with this. I know this virus is causing devastating economic consequences, just as it has caused tens of thousands to become ill and thousands to die. For 2 months, not a second has gone by where the economic impact on our working families and our small businesses hasn't been an important and paramount consideration of my decision-making. I have been listening to working people and businesses, to Democrats and Republicans, epidemiologists and expert modelers. Responsible people understand the trade-offs and the consequences of reopening too early. So I will continue to listen and to act in a responsible fashion so we can all get back to work and school and move toward normal in a way that will keep our families healthy and safe. Let me remind everyone again, the stay-at-home order in Illinois is still very much in effect. All of us must maintain social distancing, wear masks in public, and keep non-essential businesses closed until we can lower our still increasing hospitalizations and lower our ICU bed use. The danger has not passed yet, no matter whether you live in Little Egypt or in Freeport or in Quincy or in Chicago. We are making much of progress and much of the progress that we had hoped to make. And we will not let one irresponsible state representative deter us from success. Now moving on to the business of actually keeping people safe. I'm here today with IDPH Director Dr. Ngozi Ezike, of course, and the Illinois National Guard's 40th Adjutant General, Brigadier General Richard Neely, along with 3 special guests. It is my great honor to introduce on behalf of the Republic of Poland, Consul General Piotr Janicki, Defense Military, Naval, and Air Attaché, Embassy of the Republic of Poland, Major General Cezary Wisniewski, and the medical team leader, Captain Jacek Szawera. This morning, General Neely and I joined the Polish medical delegation who arrived here in Illinois to assist with our COVID-19 response on Thursday, April 23rd, in visiting our Illinois National Guard operations at our drive-through testing site in Harwood Heights. And I'm very grateful, truly grateful, for their leadership and their ability to join us for today's update. The Illinois National Guard's state partnership program with the Polish military dates back to 1993, when Poland was still emerging from behind the Iron Curtain of the Cold War. And I'm proud to say that that partnership has grown to be the most robust and successful such partnership in the United States, involving multiple exchanges between Illinois and Poland each year. The Illinois National Guard leadership and service members have forged lasting relationships with Polish military leaders. Brigadier General Neely has made multiple trips to Poland, and their leaders have made multiple trips to the United States as we learn from each other and help each other improve. That spirit of cooperation has also led to a series of boots-on-the-ground partnerships. Since 2003, Illinois National Guard forces and Polish forces have co-deployed, first in Iraq and now in Afghanistan. And I'll add that our Illinois Emergency Management Director, Brigadier General Alicia Tate-Nadeau, actually co-deployed with Polish forces in Iraq as a part of one such mission. And just as we fought together in Iraq and Afghanistan, the Illinois National Guard and our longtime partners and friends in the Polish military have joined together once more in a fight against the global enemy of COVID-19. This is an exchange that represents the very best of humanity. Medical experts from different parts of the world coming together to save as many lives as possible, no matter where they call home. The Guard and the entire state of Illinois welcome the assistance of the Polish medical delegation with open arms. These 9 members, 4 doctors, 3 nurses, 1 EMT, and 1 logistical coordinator, bring with them their experience fighting COVID-19 on the ground in Italy and Poland, which they now can exchange with the Illinois medical community so that everyone, both here in Illinois and thousands of miles away in Poland, is operating with the best practices to save lives. Since mid-March, the Illinois National Guard has provided vital capabilities to our state COVID-19 response. Currently, there are about 1,120 Illinois National Guard service members deployed throughout the state of Illinois on COVID-related missions. So what does this look like on the ground? Well, a prime example. These individuals have set up and continue to operate our 5 state-run community-based drive-through testing sites in Aurora, in Bloomington, in Harwood Heights, in Chicago, Markham, and Rockford, with more sites coming online in the near future. In a matter of days, the Guard takes what was just an empty parking lot or an old facility and sets up a testing site capable of serving hundreds of Illinoisans per day safely and efficiently. And they've done it 5 times now, all while maintaining the continuity of services at the sites they've already spun up. It is truly extraordinary work. On top of that, our Illinois National Guard is working with IEMA and IDPH to conduct state warehouse operations in central Illinois, reviewing any and all incoming shipments of personal protective equipment, PPE, and other necessary materials in our battle with this virus. All in all, they have helped to distribute hundreds of thousands of units of PPE and other vital materials to county health departments and hospitals throughout the state. The Guard is also supporting on-site medical operations in IDOC correctional centers at Stateville, Sheridan, and Galesburg prisons, and had been providing similar assistance to medical staff at our Illinois Department of Human Services developmental centers in Park Forest and Kankakee up until today. That mission was handed off last night as IEMA is deploying teams of certified nursing assistants and other staff to these centers. That might sound like a hefty list of tasks, but this is the Illinois National Guard that we're talking about. So, of course, that's just the beginning of the duties these incredible citizen soldiers have taken on to see Illinois through this crisis, because they're also providing logistical support for alternative housing facilities such as the hotels IEMA has rented in Schaumburg, Springfield, and Mount Vernon, building out the alternate care facilities at McCormick Place and in Blue Island and Melrose Park in partnership with the U.S. Army Corps of Engineers. And that's after having run the assessment of properties throughout the state of potential alternate care facility sites. Working with county emergency operations centers and health departments across the state by gathering information and assisting IEMA with interdepartment communications, and providing planners, liaison officers, and logistics experts to the State Emergency Operations Center, the State Unified Area Command, North, the Chicago Office of Emergency Management and Communications, and Cook County's Emergency Operations Center. I'm incredibly humbled by the gracious spirit of these citizen soldiers who have left their families and their civilian jobs to assist their fellow Illinoisans. And what's more, to do so when time with family is one of many people's most precious everyday moments. They are the very best of Illinois. Thank you.